Well, welcome to our very first educational webinar brought to you by the Celebration of Pets Foundation, where our tagline is strengthening the human-pet bond. That's really everything we do is towards that effort. I did recently retire clinical practice. I previously owned Lake Two Animal Hospital in Young Harris and Tri-County Animal Clinic in Murphy. And I had a role in founding the Mountain Emergency Animal Center in Blue Ridge. My focus now is to use all the time and energy the good Lord gives me to give back to the nonprofits in our area. The Celebration of Pets Foundation is a 501c3 nonprofit located in Hayesville, North Carolina, and I'm truly privileged to serve as the president on the board. I want to acknowledge Maureen Patrick, our board secretary. Y'all probably know Maureen. She's the one who's really familiar with it. She's the one who's been tracking the emails and the texts and pretty much skillfully organized tonight's webinar. I also need to publicly recognize Greg Patrick, who's been speaking earlier, and he's our webinar coordinator tonight. Greg is really a very talented fella, and he's on our board as well. And he actually purchased and donated the GoToMeeting webinar technology that we're using tonight. And he spent a lot of hours, believe me, preparing for this, and spent some time teaching Dr. Crowe and me, and you can see we're still learning. And Greg has enormous patience, and we're grateful for that. When I first started thinking about this introduction, I really wanted to go into about the foundation and the groups that we help support, and then I realized really that you're not here for that. You're here to hear Dr. Crowe. I could just rattle on, but most people who know me I like to gab, but I'll spare you that. Maureen has already sent you the foundation information in the email, so just refer to that. And I ask that you please take a moment and visit our website at www.celebrationofpetsfoundation.org. And with sincere humility, I ask that you please consider giving us a donation. We really have some ambitious objectives that requires funding. And of course, we hope to continue these webinars along with our pet rescue support efforts. Everything we do, we raise goes to the nonprofits, and they truly do great things for the homeless surrendered pets. They find them forever homes, get them rehabilitated, and make sure they receive appropriate veterinary care. They are a mixture of superb shelters, humane societies, a foster service, pet transporter, and we have one organization that provides no-cost working dogs and all the necessary training required, such as police canine units, first responders, and medical service dogs for people in need, such as veterans, and now due to COVID, all types of first responders that have or may develop PTSD or post-traumatic stress disorder. Just think of this past year with all the COVID pandemic and the thousands of first responders. I just have to think there's going to be a lot of people that need this type of support and the loving companionship that pets bring them. I do want to just show the organizations that we support, and there they are. I'm not going to spend a lot of time or practically no time on them tonight. I just wish I had the time, but we don't. But please make sure, and we will make sure and get this slide to you when we send the whole presentation to you as a follow-up. So we'll send you a link to that. But now it's time for me to introduce our amazing speaker. And we'll go to the next slide there. So I'm sorry, that's a great slide, isn't it? Really busy. And I'm not going to go through all that, but this is just the highlights of Tim's academic and professional accomplishments. And I wanted you to get a sense of what amazing veterinarian Tim is. And he's even had a major impact in the human field. Take note on the top line that Tim is a fellow of the American College of Critical Care Medicine. And that's on the human side of healthcare. Take a look at that third bullet. This is the one that gets me. Note that Tim is really a major inventor, over 50 procedures. And there's a short list of the procedures that I could understand, frankly. Nasal oxygen, continuous abdominal closures, esophagostomy and nasogastric tubing, Doppler used for monitoring blood flow. The list goes on and on. Tim is always thinking, and he thinks of these things first, and he writes them up, and then they're routinely used by veterinarians today. Tim actually worked on 131 cases of mine when I was in practice. These are real tough cases, and I was amazed that he would do procedures that he hasn't even published yet. Tim is always thinking of new ways of making things better and saving lives. Well, if that's not enough, we'll go to the next slide. There's more to Tim. That's not all, folks. In his spare time, Tim is also a certified rescue specialist and firefighter with the Coney County Fire Rescue. He's a licensed advanced emergency medical technician, He's a noted scientific author and busy international speaker. He's received many awards and accolades. The three that really stand out to me is the Zaslow Award that recognizes pioneering work, veterinary emergency and critical care, and then the President's Citation from the Society of Critical Care for his advancement of human critical care, and the Mentors Award from the American College of Veterinary Surgeons recognizes his years of providing mentorships to many surgical residents. So Tim really is an amazing teacher, as you will see tonight. But I think what Tim is most proud of is that he is a great husband, a great father, a wonderful grandfather. He loves music. It's another thing he and I have in common. He plays harmonica, guitar, and sings praise songs. And I know what he is most proud of is his deep, solid faith. Tim truly walks the talk. He is an inspiration to everyone he encounters, especially me. So with that, I can only say that it's truly my honor and privilege to introduce someone I consider a great friend and has served as a mentor to me professionally and personally. One and only Dr. Tim Crowe. All righty, Tim, it's all yours.
Oh, thank you, Hilty, and thank you everyone for coming along and joining this ride tonight. I volunteered a lot of my time putting this together, and it took me a lot longer to actually look and work with the PowerPoint, but then to go to meetings. But there is a really good demonstration to how well this works with pet first aid and CPR, and I would like to have you watch this little excerpt that happened in 1989. John Anderson and I, another really good veterinarian, he and I were working with the police officers in Los Angeles County, California, teaching them how to take care of their canine police dogs, and there were about 30 of them. And one of them was kind of laying in the back by, just, I'm never going to use this stuff. Oh, well. And he was a police officer that I thought would probably never need it. But just watch this little excerpt on this video here. And it's on 911, and you can pick it up on YouTube to look at the whole thing. This is just a short version of it. Okay.
When you become a police officer, sometimes you have to go above and beyond the call of duty. But Officer Mike Fusco never imagined how far he might have to go to try and save a life until the morning of December 14th, 1989.
Kevin is an only child, and the dog was a great companion to my son Kevin.
Oh, my mom's scaring the elephant.
I wasn't paying attention. I was watching cartoons. Really? And the next thing I turned around and he was making these funny noises.
Kevin, he swallowed the ball. I took one look at Willie, and I could actually see the ball lodged in his throat. I tried with my hand to work the ball out myself. That didn't work at all.
I knew right then and there that Mike Fusco was in the building, and he's one of our canine officers.
Mike had been one of the first canine officers in the state to be taught how to do CPR on dogs.
I never thought I'd be doing it on somebody else's dog.
Let me get a heartbeat.
We checked for a heartbeat. Nope. There's no heartbeat. He wasn't getting any air into him.
Oh, Mike, nothing.
I could see the ball lodged way down his throat. So I reached down, pulled the ball out, clamped his mouth together, and started breathing in through his nose. For every couple breaths, I started doing some chest compressions.
Move. Come on, buddy. Come on. I don't have anything. Nothing at all, Mike, nothing.
I'm just thinking to myself, there's just no way this is going to work. This dog's dead. I just got to keep doing it. It's just before Christmas time. It's kind of sad, especially for the kid.
I don't have anything. All right, okay, how do we... Come on, buddy, breathe.
I really loved the dog very much. And we were going to lose part of the family, which is a hard thing to deal with.
Let me know when he gets... Come on, hang it. Nothing, Mike.
I guess a minute and a half, 2 minutes went by, and I thought to myself a couple of times whether or not I should stop. John and Mike, they were rooting for this dog to come back to life, and it keeps you going. Because, how far can I carry this?
Let's go, out of the way. Trying. Come on, buddy.
I've always loved dogs. I felt that I had to keep going. I had to keep going, and I got to bring this dog back.
Wait a minute.
All of a sudden.
Got a heartbeat, but it's sporadic.
Getting something,
yeah,
really?
I got it.
Really? You sure?
Okay.
Okay, we got a heartbeat.
Okay, he's starting to breathe.
Yep.
He's starting to breathe. He's opening his mouth. He's got his eyes open. He's breathing. He's breathing. Good boy. That's it. Good boy.
He came back like all of a sudden. He just sparked right up. I mean, he opened up his eyes and just took this big gasp of air and started breathing. I couldn't believe it. You could tell he was still dazed. So we were ready to put him into the back of the squad car. We had thrown a blanket on him, and he just wanted to start running around.
Oh, the dog made a complete recovery, and a complete recovery from that incident of having cardiopulmonary arrest. And I would have said that the best thing for us to do would be if she would have learned and known how to work with this. So the Heimlich maneuver works really, really good, and it works really well in dogs. And maybe just right now I should probably show that. And but I guess I'm going to share my screen now, and I'm going to share the PowerPoint presentation. And here we go. I think that this works. Okay. And if I can then start. This is just scenes out in one of the states I lived in Nevada some years ago. And you got wild, crazy country out there. This is in northern Nevada, and that's my horse that we can't see in the background. So pet first aid and CPR, and I call it a basic and advanced life support. And we started doing this back in the 1980s. And in fact, before that, I gave my first course on pet first aid and CPR in 1973. And then I was at Colorado State University at the time. And so here's a dog mannequin. I can call it a pedican, I guess. And then this little girl is probably really understanding this pretty well. I don't know about the others, but they're watching. A few weeks later, after we gave this little course, and there were 15-minute episodes of this, and then they'd go, another group would come by, and this is at the University of Georgia, back in the day of about 1983. And so this little dog called Rover, we would show him how to do things, and you'll see that tonight, and how to do it. A few weeks later, after this presentation was done, we gave 15-minute presentations all day long. That people were coming into the open house there at the University of Georgia College of Veterinary Medicine. And we got a call that one of the girls, a little young girl, may have been this one, I don't know, saved her brother's life by what she learned how to get a dog stopping from choking on a ball. And I don't know the whole incident of what happened, but she did the pet Heimlich maneuver on her brother and saved his life. So many of the same principles are used, again, from humans to pets and pets to humans. So what you're going to learn tonight is something that you can transfer back and forth, whether it be a child that's in trouble or whether it be a pet in trouble. I remember that's what Hilty said. He says the human-animal bond, we are so tight together. Do you know that if you think about it, everybody breathes the same oxygen. We need that. It comes from God. Every minute of every day, we take a breath. It's a blessing. So if a dog has a choke, we got to know how to deal with it. If a little girl has a choke, I saved my own daughter's life when she was choking. And I had to do basically a Heimlich, if you will, on her and save her life. I do want to just give a benefit to this to Dr. John Anderson, who died on a tractor rolled over on him, and that was in 2006. And we were really best of friends. We worked cattle out west as a working cowboy. I've been many times where John and I would work together as fond memories. And then John and I were the ones that were teaching those police officers in Los Angeles in '89. In December, then that's when John Fusco saved that little Dalmatian's life. So I love surgery. And every day, every moment that I live, I just thank the Lord that I've had the chance to do what I do. Here I'm putting a hip together, and I got a team. And then here I'm putting ligating a patent ductus arteriosus on a heart defect that a puppy has, and it's a team. And I got some of my training through the human hospitals as well. I spent lots of time doing human surgery, of course, as a trainee. This is back in the day. Now, of course, a lot of these different things that we do today, it's all one medicine, the same kinds of things, same tools, and everything's the same. If there's a national disaster that goes on, the veterinarians are actually called to be able to help, even in operating rooms, to help in natural disasters. And this is what I do basically for a living, is I travel around with a truck and I have all the tools I need. They're all sterilized and ready to go. This is a dog that had a fractured back and we put plates on him. And of course, this was back years ago, but his name was Whiskey. And he got hit by a car and was paralyzed. And then through hyperbaric oxygen, which we're demonstrating here, that's me with another dog, not Whiskey. Whiskey was just a really crazy dog that had been hit by a car and fractured his back. We were able to put it together, and he did go back to being able to walk again with hyperbaric medicine. And I'm going to share with you that the American College of Hyperbaric Medicine is something I also belong to. We know that it also helps with PTSD. It helps with brain trauma, with traumatic brain injury. It also helps with COVID patients. And now that I'm sad that I don't see that being used, but 95% of the people, if they get into a hyperbaric chamber, live. Even if they're about ready to go onto a ventilator and they go into a chamber, they live and they're only in the hospital for a few days. It's just that most hospitals don't have very many chambers, and that's probably why you're not seeing it used much. Hey, so here's a dog that's in one of the chambers that I had in Nevada, and don't you look, he looks happy. He's just looking out through like a submarine. That's what he looks like there. And you know, the pet ambulances, we started those back in the 90s, and they start to even grow now. And there's pet ambulances in a little different places all over. We call them veterinary emergency medical technicians or veterinary emergency medical first responders. And this is, you know, back in just a regular ambulance. Here, this is fire rescue. This is when I was in Nevada. And then, of course, the back of that rescue just looks like you could put a dog on it, right? You sure can. And in fact, most all EMS around the world, if you will, if you have a dog that gets injured and he is a canine officer, he can even go into an airplane. Of course, an airplane's for dogs too, but he can also go on a helicopter and fly wherever we need to be. We had a landing zone at least placed out as to where to land helicopters when I was in Milwaukee, and then also other places as well. And so these are these guys, a lot of these are volunteer firefighters too, like I am. I'm a volunteer, and we see that there's need for pets as well. And so we have police officers, firemen, and many others. And you maybe as well would want to start a pet ambulance service, and it would work for you. So the goals with all emergency care, and really this is just maintaining ABCs, the airway, breathing, and circulation. And you have to do that in a timely fashion before there is a problem. You know, for example, you have a fractured mandible with an injured tongue, it's a blocked airway, you know, then you know, A, just think of A. That's as far as you need to go. Until you have a clear airway, don't go to B. If you don't have a clear B, don't go to C. That is common knowledge. Now, the American Heart Association has jumped from, with the way things are going with the amount of heart attacks we're having. If a person drops over and you see they're unconscious, completely not responsive, and you can check for a pulse, wait 10 seconds, check it well, then you start C. Because most of those are adult people that have a fibrillatory rhythm that's caused by their heart attack, and you go right to C. During C, when you compress the chest back and forth, you're going to get a little bit of breathing back because it puffs back and forth through when you compress the chest, there's a little bit of movement that goes back and forth, and a little bit through the airway because the tongue isn't in the way when you're completely unconscious for most situations. However, take that the opposite. Let's say it's a child who gets obstructed and has a super ball back in his mouth. You would first remove the super ball, and we'll teach you how to do that with a dog too, of course, or cat. And that'd be kind of big for a cat, though. But yeah, you could get a cat with, and I'll talk to you a little bit about a cat we called Meat, because he chewed all this meat up as fast as he could. And he lived, the people lived next door across the street from the emergency clinic where I was working. And the little boy ran the cat over to us, and the cat was blue. He wasn't breathing, and he said, and he just swallowed a bunch of meat. Okay, so all right, we're going to take the little one back here, and I pulled out meat upon meat after meat, the size amount of his head. So then we were able to go from A to B, and we gave him some breaths, and we'll teach you how to do that tonight. And then we can go on to C and do compressions. Then it's a different story. You always go A, B, C, unless, and this is again, going to write C without having an A and a B, make sure you check those. All right. So just like anything, I'm a volunteer firefighter, as I told you, we have to keep up practicing to stay certified and all those things. That's me right there and my friend Eldafo. And we're doing first aid is a training thing, a training exercise, just like in this burning building exercise here. It starts with education and training and learning the skills. So I would suggest that when you get off with this course, is you take one of your stuffed little animals. You know, this is called Scruffy. You can see probably why it's called Scruffy. My granddaughter calls him Scruffy. And you can imagine, oh, by the way, so I taught her how to do a tracheotomy. No skin should come between you and the airway. And I told her that and showed her. And of course, but anyway, you can teach CPR and use the Heimlich maneuver, if you will, with her head down and squeezing. You can teach all that, and it works very, very good. But then do it. After you get through, do it, then teach it, and then they will learn it. And then you'll go on, and you'll be able to spread the word, okay? And who knows, you may be actually using some of this skill tomorrow night. For example, you're driving home. This is a car crash that happened in front of me as I was driving to work one day. And this guy was in this car, and he was in trouble, really lots of trouble. He was bleeding a lot, and I was able to help be a first responder in that case. It was like I'm a good Sam, even though I'm a medic with the fire department. I just pulled over. I did put my turnouts on because I then had to break out, get him out of there in a hurry. And we were able to bust out the door, and then he was able to be rescued, and we got the bleeding stopped and everything. And the bleeding, of course, you know, if you have a really major bleed, it only takes a few minutes for that to be in real trouble. So that's these life-saving skills you're learning. It's all creatures, great and small. The Lord God made them all. So like putting direct pressure in gauze, soaked, okay? If it soaks on through, you leave the gauze there, you just get more, unpack it in, and you go and put more pressure in there and more pressure. And you do the best you can with the pressure while somebody is getting the keys and driving. And you're driving to where? The veterinary hospital, and then call with your cell phone on the way, hey, I've got a bleeding pet that's coming to you, please. This is what I've done for him so far. I've just put pressure on the wound, and this is all I can do right now. And they say, we'll be ready for you. That way, they've got a clue. Now, make sure that you know when they're there, you know what their hours are, the fastest way to go safely to there, and make also sure that you know that they can handle what you might be handling with them. And you may end up having to run and go get a unit of blood for them or something like that if they don't have it. I would like you to suggest you do first procedure you do tonight after you get through with the course here is go to the American Red Cross and to an app that you can get and put it on your phone. And that phone app is a really nice phone app to have, and it's free. And it goes through the different places that if you have an airway problem or breathing problem or so forth, a lot of stuff what you're learning tonight is in there, plus a lot more information. Remember, this is a first 1 hour course, and we're going to do a series of 3 at least. When we're teaching police officers, it's a 2 or 3 day course. In any of the rescue responders, search and rescue and so forth. It's something that we need to do. So again, download that pet first aid and CPR on your internet, off the internet of Red Cross. You can go ahead and get it and look through it. It's really a good, handy thing to have. And review the information I used to teach for the American Red Cross. And then I got one of my interns when I was in Wisconsin got really interested in that, and she wrote a book called Pet First Aid. And again, it's through the American Red Cross, and that's Dr. Bobby Mamoto. Thank you, Bobby, for all you're doing, and she's also a master in public health. So when we do these, we've got to classify the emergency on just on looking at things. This is the education part, based on time before it's too late. You know, when I was in Europe, I'd hear these ambulances go, too late, too late, too late. And that's really the most important thing, is if you can do prevention. There's no, like, for example, the little excerpt of the scenario you saw with the Dalmatian. If they wouldn't have never used the super ball in the first place and used a big tennis ball or something, then the dog couldn't probably. Now, tennis balls can still get blocked, but at least it's a lot better than a super ball. Airway obstruction, a piece of food, kibble, even just kibble. Your dog, you could be just feeding your dog some kibble, and a piece of kibble gets stuck in the larynx, and then you need to be able to do the thing to do. And I had a dentist friend of mine who said his own dog back in the 70s, he had a dog get obstructed, and he just did kind of like the Heimlich. He turned the dog upside down, and he squished it, his abdomen and chest, and out came the piece of whatever, and they never even found it really. He probably swallowed it. And the dog was done to do well. Another thing is called gastric dilatation volvulus, is when the stomach actually rotates. And the stomach, when it rotates, boy, it can then rotate and then get expanded. And as it expands, then there's no blood flow that's going as well as it should into the chest and heart and so forth. And they can visibly get in trouble. Within an hour, they may have less time than that. If it ruptures, the stomach could rupture, or the spleen could rupture. Spleens, of course, can rupture, and then we get what's called a lot of blood in the abdomen, the hemoabdomen. In those cases, we're teaching this right now, is that you can take all that blood and auto-transfuse it and give it back to the dog. And I did that in one dog that was a Great Dane that had rotated his stomach. It ruptured the spleen, and then blood going into the abdomen. And before we could all get through all this, the entire almost blood volume of the dog was in the abdomen. 4 liters of blood we auto-transfused back to that dog. It was a 12-year-old Dane, and she went on to survive because we auto-transfused her. And yes, you cannot just do it with fluids. You have to be able to use blood to do this. And even though it may have been, let's say, iffy in terms of the blood, in terms of its bacterial, could there have been a little bacteria there? Sure. Was it the best blood in it? But it's dog's own blood. You can do that. And so you did that. It's called auto-transfusion. And you can do that, and it saved this dog's life. Or a stick, foot stuck in a fence. You know, it's not obviously bleeding, but the dog's really anxious. There are acupuncture points that you can use on both sides of the ear, just the kind of calming points. Also on the very top of the head, the very calming point. In cardiac arrest, we can also use this point, Governor Bessel 26. It's right underneath the nose, and you push hard. In fact, I watched the James Herriot movie, All Creatures Great and Small, and one of the things the young veterinarian was doing was pulling out a calf that was in trouble. It had twisted its neck while trying to get out of the uterus and this calving that was going on. And the first thing that he did is he took a piece of straw and stuffed it right up here, and that stimulates breathing. And so don't forget that one. It's good for shock, and it's good to start the breathing. For puppies, for example, that are having difficulty with a birth, don't forget this one. And when I had a human patient, and I can't go into all details, but I can tell you that we were 20 some minutes out, and he hadn't had any heart start at all, and I was doing all the chest compressions, didn't stop, and it was like 25 minutes out, and he went ahead and had a full recovery, because I think we accidentally did that point, and he took a breath, and we go, hallelujah. And so he went on to get his surgery, heart surgery that he needed, and he went on to survive. It is just an amazing thing. Once you start things like CPR, don't give up. Keep on going until you get him to the hospital. Keep on going. Do not stop. Okay. And let's see. Stuck here a little bit. Okay. So you're going to do a rapid assessment. And this is just an overview of a patient, which you're not really sure, but you always start with safely looking around and make sure that you can do what you got to do. We had a little puppy that was in some water, and it was just after a storm, and a little girl was running out to get the puppy that was in trouble, and then she would have been in trouble, and we had to just the power line had to be shut off. The girl was fine, but if she would have gone in there with the puppy, they both would have been electrocuted. So always look at the safety. Seems safe. Is it safe to be able to do what you need to do? And that might start with just making sure that you've got an animal that you can handle, so you won't get injured. Then we start what's called the primary survey. So make the scene safe. Now look at a general impression of the patient. Let's say let's this little guy right here, or it might be this dog right here. Hey, are you awake? And you start with that, and you start with a general. Now this guy's unconscious. That's what it was. You look at the level of consciousness. You get a general impression of what all the problems might be. You then do, is he fast breathing? Is he slow breathing? Is he having difficulty breathing? You look at his oxygenation. You look at the color kind of quickly. You know what blue and cyanotic looks like. It's like the color of this screen here. And it should be nice and pink, and it goes to blue. If that is really a sign that the oxygenation in the blood is not going well. And so you want to be able to get things back to pink, don't we? So oxygenation, that's a mucous membrane color. And then we can look at cardiac function by listening. We can just put our ear. And this is what I want to suggest you do with your own pets. And then, they're good and kind and everything, is listen. Listen to their chest wall. Listen to their lungs and how they're breathing with a soft sound. And listen to the heartbeat, lub-dub, 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 and kind of the speed of it and all that thing. And then you're going to look and also feel the pulse in, of course, the inguinal area. This is right underneath the area of the inguinal area. Then you'll get a capillary refill time. We'll demonstrate that in a little bit. And hydration, how hydrated are they? By looking at the dryness of the mucous membranes, and by doing a skin trigger, by pulling on the skin and letting go, and it should pop back right pretty well. And then, of course, you can always then go to vital signs. And the vital signs are like temperature, pulse, and respiration. There you get an accurate number. And so if you can call your veterinarian and say, my dog's temperature is 103, his heart rate is now 100 and let's say 20. So what you've done is you then take and count, for about 15 seconds and multiply by 4, and that'll give you the heart rate and the breathing rate. And then watch the breathing and get an idea. Is it going faster or slower? These are kind of things to get in and handle. What does your own pet do? Dogs, cats, any other species you have. It's a little harder with the real little ones like hamsters and gerbils and so forth, but do what you can. You can watch them breathe and see their little tiny breaths. So what about the certain scenes safety on this one? This dog is coming at you. You need to run. Just kidding. But if you've got a dog who's acting like this, you've gone as far as safety, and that's as far as you'll get, and you can get a general impression of him. What about this one? This is a little kitty that was unfortunately had a head injury. It was pretty severe. She's unconscious. What else can you say? Is she breathing? Has she got a respiratory breath that you can see? Yes, she did. What else you mentioned? Oh, well, you can see while she's unconscious because she looks like she's got a pretty bad head injury here. And those are really things that you can do. And then you can start with the opening up the airway, starting with breaths if needed, and going from there. Caution on breathing is make sure that they are unconscious before you start to do anything that you have, like using your mouth next to their mouth. And the other caution I'll give you is there have been animals, especially in Georgia, we have what's called timic. It's a organophosphate, and the pets get into the organophosphate, like a bag fall off a truck or something, and they could start to seize, and then they could start, they got covered with this white powder on them, and then they go unconscious from the seizing unconsciousness, and then they go and stop breathing. And then we've had animal owners try to resuscitate that patient and get themselves in trouble that way. So in those cases, it's always a good idea, and I'm going to teach you to get some kind of a mask. So you will never put your mouth on their mouth. Rather, you'll use, of course, a mask. And then you'll put the mask, and therefore you're staying safe. Well, this lady was in trouble, and then of course her husband got in trouble with all that. So again, just to review, level of consciousness is that we have they're bright and alert and responsive, they're quiet, alert and responsive, and then goes down from there. And of course, airways, it clears, it quiet, that's what we like to see. A respiratory rate of between 12 and 20, and with hardly any effort. And a capillary refill time of less than 2 seconds. When we put our finger up on the membranes and let go, and it should within 2 seconds fill. It should be from pale to pink. And you can use it on your finger. You can do that with your finger, and again with your fingernail. You just push, and you let go, and push and let go, and you'll be able to get that. Mucous membrane color. Capillary refill time, we talked about that. We now heart rate. We use the pulse rate, we use the femoral artery, and it's usually between 60 and 120. If they're a little bit more anxious, it could be a little higher than that. If they're very, very cold, that might be that's the pulse rate you have just from their cold. And then again, pulse strength, it should be strong and when you palpate it. Unless, of course, little cats and dogs and little ones are a little harder to feel their pulse. And that's something that we see. So here's the capillary refill time. This is a dog who's under anesthesia with a breathing tube in, an endotracheal tube. And we're just pushing down on the membrane, and we're letting go. And it's seeing how long it takes for the pinkness to come back. So 1001, 1002 should be coming back. Now be careful a little bit as you pull the lip up. Make sure that it's not so tight that you're going to just impair the circulation that way. It's just a very gentle pull upward. Okay. And here, then checking a pulse, you should actually use more than one finger. Use 2 or 3 so you can kind of get a really good feeling for the flow, and that's the femoral artery in the back, right at the inguinal area. You should be able to feel that in your own dog or cat. It takes a little time to feel of it. You'll be surprised how little amount of it is in the kitty cat sometimes, especially the smaller ones or the puppies. And then here we're checking the heart by feeling the per pulse as well as remember we can also listen, just having our head down for listening to the heart. And then here we're looking at both heart rate at the same time as feeling for a pulse, and having the hand come over the front for a pulse is a good way to really manage that, to be able to tell. And notice that you got to be able to just to make sure that you're always a little on guard. This is an animal, he's got teeth. Make sure that there's always a way for you to be able to move back if there's something that goes on that's not right. And here's a semi-conscious dog that it's just looking at, we're getting a heart rate as well as we're looking on our getting 15 seconds so we can actually tell what that is and be able to kind of write that down. Keep an eye on what those rates are. And temperature, the only really good way to do it is with a thermometer, and that'd be a rectal thermometer. That is the kind we have these days. It's an oral thermometer. You can't get rectals very much, rectal thermometers. So just use a regular oral thermometer from, Walgreens or so forth, and just be really gentle about that and be careful about it when you do it. You can also use this on the inguinal area or underneath, again, the inguinal area. You can use a buccal underneath the mouth, in the lip, underneath the lip, lower or upper. You can also use the inguinal area and again, the axillary area. So those are areas that you can also use. One of my interns did a research little project with that before. So go very slowly. If a pet is cold, especially if they're having difficulty breathing, do not do rectal, do this temperature rectally. Use alternative areas like, again, the axillary area, the front leg, or back leg, the groin, inside the lip. Why? Because it can affect heart rate, especially what's called a vasovagal. The heart can go can go down. They have the vagus nerve has been stimulated because of their being cold or they're having difficulty breathing, and you can throw them into a cardiac arrest. Do not then do a rectal that way. Do not do rectals. You can use a laser-guided infrared thermometry, and that is something that, of course, we all know about that from COVID now, as we kind of get our foreheads shot with a laser-guided infrared thermometry, and you can get those and buy those at the Corsa store as well. So you imagine, again, the priorities are A, go with A before you go to B, make sure B is good before you go to C, and then go to C before you go to D and anything else. D stands for disability. So airways, breathing, circulation, disabilities, and then everything else. Here's an example of a dog who just got as far as airway because he was not breathing, he was blue and cyanotic, and this is a plastic syringe case. So it's just like the end of a syringe case can be the end of the one end or the other, and you can use those. You can use any kind of tube as well. You can use a tube of any kind, and you can make sure that you can just slide that in. So that is an oral pharyngeal airway, oral, and the pharynx. And this is a fractured jaw that was really bad, and I wouldn't have been able to fix it unless this had been something that a first responder did back in Detroit. And it worked really, really well for this dog who got a very bad fractured jaw. And he went on to go and do well. He did. He went on very well. He had to have surgery, of course, to fix it. So let's look a little bit at the whole anatomy of the pharynx and larynx and so forth in terms of the airway. So here's the trachea. You can feel that, of course, on you. Here's the esophagus down here. And, of course, you've got this epiglottis. And then you got the tongue. And if you can imagine, if you get into trouble with a large swelling from, let's say, a snake bite, and the dog starts to swell his neck up, you could use that oral pharyngeal airway if he goes unconscious to help save his life. At the last resort, if it's really a lot of blood, for example, from rodenticide toxicity, and let's say he's bleeding back in the bottom part of his mouth, what can you do? You can then, of course, even if you have to, you can do a tracheotomy. You can make an opening here, or you can do a cricothyroidotomy, which is up in here. Either of those work very well, and the skin is primarily the things you have to worry about, and a little bit of muscle, but you'll get to the airway and then put a tube in it of some kind. Yeah, it could even be the end of a pin. You've probably seen that or heard about it on maybe some movies or something like that. Okay. So let's just look about the airway. If the patient is having trouble breathing, difficulty breathing, suddenly, you have to think potentially there could be, is there an injury there? Is it like that dog we just looked at? Is there a wound that is disrupting the trachea or the larynx? That's happened to us. We've had a dog that had a larynx that was totally ripped right inside the chest. And the only way I could save that dog's life, and we did, was to cut this all open right here, right away, and put a tube in the non-disrupted part of the trachea. And it was a little Boston Terrier that got his head stuck between two things on a fence. And he pulled his head back, and he just pulled his trachea away from each other in the chest. That when we had done at University of Georgia. Or is a foreign body? Is it possible? Suddenly they can't breathe. That's one that you think. Then if you see that suddenly, think, he's got a foreign body. So we do a modified Heimlich maneuver, a piggyback his legs up, pick him up, and then squeeze his abdomen and chest. Just squeeze it. And shaking him. Consider shaking him with his head down. And then, of course, consider pushing behind his mandible if there's a round ball back there. And we'll kind of go through that. So here we are with just showing with a pelican. Rover here, we can kind of just pick him up and shake him and squeeze his chest. And oh, sorry, that's upside down, but you can say that, sorry about that one. All right, so the head's down and you compress his chest and you compress him repeatedly and until the foreign body comes out. If it doesn't come out and he goes unconscious, well, then you're going to be looking for things like a super ball that's stuck in the larynx, or dog food, it's in the larynx or trachea. We've even had little pieces of stone stuck in the trachea. I had a little kitty that aspirated a stone, and it came in rattling like a rattle, and it was having trouble breathing, and then it wouldn't. It would have trouble breathing, and then it wouldn't. The stone would rotate inside the trachea, and the air would be getting by, and then the stone would rotate away another way, and then it would be obstructed. That little kitty needed to be shaking a lot to get that little stone to get finally unstuck and out. Then that could be, of course, when they need sedation or even having to do some fancy thing. Meat, we talked about in the pharynx or the larynx, peanuts, marbles, stones, jelly beans, and even tennis balls. And let's just talk about that for a minute. Now that's generally then in the stennis balls, it's usually in right about here, the stennis ball gets stuck right behind the hard palate and right where the soft palate starts. It gets stuck there, and then what you do is push right there and it may pop out. And that's what, especially when they start to really paw on their nose and they go like this and they just seem to can't get anything on, and then now they get all excited and then they're salivating, they kind of salivate, and then all of that helps grease up that tennis ball. So this is where you'd push, and there's where the tennis ball would be back in here, and you wouldn't be able to see that often because they're not allowing you to open up their mouth. It doesn't happen. So then just get back here with your hands and push, and you're going to be pushing here, and then the tennis ball, which is lodged here against that hard palate, will then be able to be pushed out. And then shaking them. You know, this is another one. Just keeping them upside down really helps. Gravity is your friend. And hopefully that's what happens. So extend it now if they're unconscious. Now they're fully unconscious. You're going to extend their head and neck. You're going to then pull the tongue out. And you're going to then open the mouth as you do this and look easily. Look, you should be able to do it easily if they're unconscious. Now, if they're resisting you, then you may not be able to say they're unconscious. For some reason, they may be unconscious for another reason or something, but it's not something that a dog loses consciousness. The deeper they go into an unconscious state, the more you can open up their mouth. And you may have to allow that to happen. And until that time, you continue to compress their abdomen and compress their chest until they are fully unconscious. Then you look down deeply inside, and you may want to try to use a clamp to do this, like a towel clamp or some other clamp. And I would suggest you go and buy a towel clamp or a Tenaculum Forceps, and I'll show you what those look like. And even a hemostat. That's how we got all that meat out of that little cat. We just used a curved hemostat and pulled all that meat out once he was unconscious. And he was unconscious because he's had a lack of oxygen to his brain. So here's a Tenaculum or Forrester's sponge forcep, and here's a Tenaculum forcep, and they are long enough that you can get kind of around there. The Tenaculum has little sharp points to it, so you can grab a ball with it pretty nicely. And I even laid out some more tools here. Here's a curved hemostat, a Tenaculum, and a towel clamp. And the towel clamps can also be used when we do CPR. And I'll just kind of demonstrate that just a little bit. CPR is just mainly because it's just compressing the chest. That's what it is. It's 100 times a minute compressing the chest. And as you do that, you would take that clamp, if you had one, and then you clamp into their chest wall and pull out and pull in. By pulling out and pulling in, you get better ability for the blood to go back in the chest from the abdomen, for example. And then when they push, then of course the blood goes up, up into the heart and lungs, and that better. So you will do a better job by using a Tenaculum forceps or a towel clamp, one of these that you can grab a hold of a rib and pull up and then go back down. And you'll do that by, again, clamping and then going up and then going down, up and down, up and down. All right. And so here I am looking at just, I'm reenacting this. Of course, they go from a pink color to a blue color, and it can happen quickly. Within just the time you see this click go just all the way out to about to the round to a minute, a lot of animals and people will have a blue color starting this really deep color, and it gets deeper and deeper. And then here you're looking inside the mouth. All right, I don't know if I can see that to you well, but you open the mouth, you look for the foreign body, remove it with a clamp, and you remove, or you can use a spoon, something like that. But I would highly recommend. It's only there a few dollars. For $10 to $15, you can buy any of these clamps on the internet. Okay, so here's an unconscious patient. Right, you can't. He's not, and he's blue, a little cyanotic. He's a little pale and cyanotic. He's not. He's conscious at all. So here's a not quite so blue, but you can bet. Can you see that little ball, little tip of blue there? That's actually a ball, and you can't see it here. There it is, And then what you do, you can use, again, the clamp to get it once he's unconscious completely, or if he's still conscious, try putting, again, your hands up underneath his mandible and pushing. But before that, and again, using the Heimlich maneuver as well. Now, the reason this dog came in the clinic is John Anderson was able to pull this ball out after he knocked him out a little bit with some sedation. And look at this, the reason he was still alive is that little hole was lined up enough that he was getting a little bit of air past there. And he went on to survive. So again, an airway should be nice and quiet, and it should be something easy. You shouldn't have any kind of sound much to it at all. If you have sound, there's two kinds of sounds. An obstructive sound like this. Okay, that's totally obstructed. You can have a sound like this on inhalation. That's more laryngeal. The first one was pharyngeal or laryngeal, back down deeper. And then, of course, we have the nerve. When he's unconscious, here I'm using a clamp to grab a hold of that little piece of foreign body there. Extend the head, open the mouth, inspect the mouth, use Tenaculum Forceps or other forceps. Use your finger sweep. If you do that, like you saw John Fusco do that with that dog, make sure they're unconscious first, and that you can get behind the foreign body. Otherwise, you can make it worse by shoving it down further. So head down and shake and do abdominal compressions. If you can't get it out, then you'll repeat. Use that gravity to help you, and that includes with children, for example, with a foreign body, making sure you're using gravity, keeping your head down, and using compression. And you'll do chest compressions. You'll hit them, of course, like this, and then you'll check and form their body and see if there's a foreign body there. And then if not, you're not out. You do some more. So you can compress this way. Okay. So review questions. What is the most important in terms of assessment? Just think about that for a second. Staying safe, right? Survey the scene. If a pet is suddenly having difficulty in breathing, when are you, and you are feeding him, what should you do? Sudden difficulty breathing, and you're just feeding him, and now he's in trouble. Now the answer? Give him a Heimlich maneuver, Heimlich-like maneuver, just like we talked about. So what if the blockage is so bad that you cannot get anywhere? And he's obstructed. He got into something and he's obstructed, or he can't breathe because this is a dog with rodenticide toxicity who couldn't breathe at all. He's absolutely couldn't breathe. And so what do? Well, we can knock him out, but he's already in trouble. So we did an awake. He's not awake. A tracheotomy. He's completely unconscious. We opened up his neck here, and you can see there's the tracheal rings. There's the muscle. And then we put something in there, a little bit of this knife that we use. That's, of course, a little blade. You can use, things they're used. Of course, when I was in Boy Scouts, we learned to use a pocket knife. Just a simple pocket knife, all right? And so, again, skin should never be between you and a airway. So there's the trachea down here. Here's the cricothyroid area here. Here's we're using the end of administration set, an IV administration set. And then here's being popped in. And here it is again, and then there we just tighten it in place, and then we, of course, put our breathing bag on there. So there's a tracheotomy. There's done with a scissors, do with a knife. I've done it with even a bandage scissors, or I've done it with a regular kitchen scissors. And then here we are. That's the only thing that you've got to pay attention to is staying away from the sides of the neck. Stay in the middle, and you'll be all right, because the big vessels are on the sides, on either side of the neck. And then there was the opening there. It's just a couple of little schematic drawings that I showed that if you can, and you can put a headlight on, you'll see better. If you have a headlight, everybody should have a headlight. We'll talk about first aid kits next time, and we'll go into more CPR and how that works as well. But you'll be able then to make even an endotracheal tube out of a tube, like a piece of plastic tubing that you can make, at home. Or ask your veterinarians to have, when they throw out an endotracheal tube that's not good anymore, have them save it for you based on the size of your dog or your cat, so that you can use it for a tube if necessary, help save his life that way. And so here's an example. That dog, by the way, was that dog you just saw is this dog now. He came in with a very severe head injury and bleeding all over the place. And then we went on to save that dog's life by giving him a tracheotomy. And there's the tracheotomy site right there. We never close it. We just clean it up. And it's amazing how God made these for us to be able to save these lives like this. So penetrating trauma like sticks, don't throw long sticks anywhere. We've had dogs that have punctured their whole trachea or worse into their thoracic inlet, even down in their inlet. And then laryngeal paralysis is something that you'll see more gradually. It's a gradual onset. Keep dogs out of the heat. If you start to see that, and have your veterinarian take a look at the dog. Noisy breathing. Laryngeal spasm can come from blunt trauma, and you can get what's called an elongated soft palate, where the palate is just too long. So with breathing is the PET breathing. Look, listen, and feel. Look at the color of the mutant membranes. Is there any evidence of thoracic injury or trauma? With not breathing, pull the tongue forward, close the tongue on the incisors. Close the tongue on the incisors. This prevents them blocking their larynx, and it helps seal. And especially the important thing with dogs with long, thick tongues or big, thick tongues, because those tongues just can cause some problems. So be able to pull the tongue out on those, but don't pull so hard. Just pull it so the tongue is being closed over by the lips and, of course, the incisors. And I'll demonstrate that in a little bit here. And, of course, provide mouth or mouth to nose breathing, or you use a cone mask, and which is very, very helpful because you can do that a little bit better, and it works. If it doesn't quite work, reposition the head and start again. May have to pull the tongue forward and wipe out the mouth, if you will. And you can even use a little syringe. You might get that in your first aid kit, like an ear syringe you have to suck out fluid. And then check for a pulse. Use 10 seconds to check for that. And, you know, these breathings, and same way with breaths, you know, check to make sure they aren't breathing before you try to do something. And first, make sure that they are truly needing to have, they're unconscious. Here am I some years ago, wearing my shirt and tie, and of course I was wearing glasses then. Since I had all my hyperbaric treatments for bad wounds injuries in my legs, I have not had to wear glasses. Just one of those things about hyperbarics, it helps you that way. So here I pulled the tongue out, and the dog has extended his head and neck, and he is unconscious, and we're going to then put our mouth right over his mouth, more of his nose. It's his nose you're concentrating on in a big dog like this, and the little air that gets by on either side, don't worry about it, but try to position it so most of that air that's going in his nose is going to go down into, of course, his chest. What if his nose is completely squished from injury? You know, or he's got blood in both nostrils, and that's not going to work. Then you're going to have to put a tube as an oral pharyngeal airway, and then use that to help breathe for him. Okay, or again, you can use a bag valve mask, which is what they call those things. And these rescue breaths are then given. And, you know, you can even do it on a pet who is awake but having very difficult breathing, is you can also time his breath with your breath as you're giving him, I should say, a bag valve mask, not with your breath, with you're giving him a bag valve mask squeeze with a mask. And then here's, of course, a dog with difficulty breathing. This is what we're doing. We're getting bag valve masking, give him that breath, and it's helping him. And he's taking a breath. And then this dog fell asleep completely because he needed help with that. And then he, of course, gets to the hospital, and then you can do more with him, and even may, you know, help him with his congestive heart failure or whatever. Circulation, we talked about. We're running a little out of time, but we're going to go just a few minutes so I can do a demonstration. Check the femoral pulse, and if you're not sure that there is a pulse, then start CPR. The heart beating, sometimes it beats. The hearts usually beat in animals. They don't just suddenly stop. Most of the beats from our research that we did, and some of it with the American heart, everything like that, hearts usually in kids as well, children do the same thing. If it's an asphyxic arrest, the heart really slows very quietly, slowly. If they have something that's going on with a foreign body or something. Though those hearts may still be beating a little bit. that heart might be beating slightly, but it's only slightly beating, and you won't feel it. There'll be no pulse. Start CPR. Then the airway opening again, getting the breaths in, and then go ahead and get that heart going more and more, and that will usually then bring them around. This is a little Doppler, which I'll use to just demonstrate something. This is how CPR actually works. And I'm going to turn it on after I get it in place. So that little machine you're seeing right there is what's picking up my blood flow. And now I'm going to bear down, and I want you to hear how fast that blood flow changes. That's called a Velcello Maneuver, and that can cause a vasovagal arrest, especially if you have a sick animal. Here we go. I hope you can see that. I'm going to hear it. Now I'm coming back. And this is how CPR works. Every time you cough, that's how it is. Cough CPR, it's called. And that's just the way that CPR works. That's my blood flow. And Dopplers are used, and we did a lot of research with this. It's very good, and we teach this to the advanced people, to use this on the eye. It's quieter. My Doppler is starting to run out of a little energy. All it is two piezoelectric crystals, those little crystals there. It sends out one signal, and then it detects the other signal coming back, ultrasound. If it's you can do this on any species. You can buy these for around $400 used. We've used them in ambulances, on helicopters, and so forth. It's really, really good. So there is blood flow. And then let's suppose you have a bleed right there. You would push right where the hemorrhage is, and you can stop the hemorrhage by pressure. And I'm pushing down right where my radial artery is, right over where that Doppler is, and I got no flow. Now we'll move on. And this is us just doing this on a cat who's been injured, and he's on a board to keep him from moving. And he's also been sedated and got some pain control, and he's getting oxygen here as well. Here's a dog within 30 seconds of a heart stopping beating or very poorly beating. Eyes will dilate and become fixed. So just because you have a fixed and dilated patient may not mean that he is a goner. Because we've had patients with fixed and dilated pupils, because the brain is so sensitive, especially in the area of the occipital cortex area, where the blood flow goes again into that area, it is very sensitive to poor blood flow. And you'll see this fixed and dilated pupil within 30 seconds of a cardiac arrest or a near cardiac arrest. The brain doesn't determine that. That heart can still be beating slightly, and you can still have a fixed and dilated pupil. Those patients are the ones that really respond quite to CPR. And of course, we shake and shout and make sure he's unconscious. And then we do our mouth to nose ventilations. And the reason I, as a rescue specialist, like to start with breathing after opening up their airway is first to make sure their airway is open. Secondly, make sure that you give a couple breaths inside the lung, because when you do that, that helps also with your chest compressions to do a very good job. Then if you, of course, are using the towel clamp on their chest, raising and lowering it all the time, that also helps the air get in. Don't worry about then the air. Once you get those 2 breaths in, and you have to practice this. This is something that you have to do with a bag valve mask or your mouth or whatever. Make sure you get the breaths in, and then you will be ready to get to go with CPR. So the mouth first, Of course, you're trying to get to the brain, and you want that brain to get blood flow, so you get oxygenation, and then you start the CPR. So make sure that you're unconscious. Open the airway, check for foreign bodies, etc. If not breathing, begin rescue breathing. 2 breaths, all you will do then, and then you will check to get everything going. Now, if they're not breathing, then you check for a heartbeat, and then this is where the demos come involved. So I'm going to try to now do this, check this out. I'm going to take the screen off, and I'm back to being a demo now. And I'm just going to do a demonstration with my big dog here. Oh, by the way, you can kind of make, if you will, this is just a bag valve mask is a mask, and you can make them even out of cardboard. You can make the mask so it fits over the dog's face, and then you can imagine you can taper it with a funnel. You put a funnel on the end of it, and now you got your bag valve mask with a funnel and some cardboard and some good old duct tape. Otherwise, you can go ahead and buy one of these. They're about $15. This is a bag valve mask. It's a spear. It's $15. You just go on the internet and find it. Okay. And again, what that does, and this is an artificial lung for a minute, and then you can see what that does is that puts the air inside the lung, and then of course it lets the air out, so that you get exhalation. You'll give a mild breath, 2 of them. Make sure you get 2 breaths, and of course, so that way, if I'm ready, if I got this all lined up, and for those of you that are ready, like in getting first aid stations ready and all that, have this ready to go. Just have it there and all plugged in and ready to go. Then, of course, now you're got an unconscious patient. You make sure he's unconscious. You check for a foreign body. No foreign body here, we can see. Then you're going to do mouth to bag valve mask ventilation is pushing the mask all the way up to their eyes, really, to get a good seal. Then giving them a couple mags. Then you're going to check, of course, for a heartbeat. And if you got no heartbeat at all, you may want to, if it was, depends on the history. How did they arrest? Why did they get in trouble? If it was pneumonia or something, then go ahead and have somebody else do this. And then I'll give this to my partner. Somebody else can be doing this. All right. And then otherwise, you're going to do CPR. And in this dog, I'm a little bit too high. The table has to be, I should be up on something because I just can't get down and do a good compression. If there's a little puppy like this, I can do chest compressions, even both sides. Both sides to compress. Have their head down a little bit, and then just compress both sides of their chest wall. That's about as all you can do. Now, if you can do an abdominal pump where you squeeze the abdomen between chest compressions, and that's called abdominal counterpulsation. And what that does when you squeeze the abdomen, that pushes the flow forward into the heart and lungs better, and then you can compress both sides. I hope that shows up pretty good on the screen. Now, in a great big dog like this, and it's kind of hard to do, I am going to then pull up a chair or something, but don't have time for that right now. So I'm going to take, without the clamp, I just go like this. Okay, that's not as effective for a big dog like this. A really large dogs, put them on the floor, and then put your foot on them and compress them. And the rate should be as fast as you can do it, carefully, but allowing the hand to come off the chest wall enough that you're going to get rebound back. So that's 1, 2. About the size of, say, remember the old Staying Alive song? You can go to Chattanooga, Tennessee firefighters, and they have a whole dance that they do. But people will have remember the staying alive, staying alive, staying alive, staying alive, something alive. That's a 1. So those you do about 30 of those, as much as you can. And again, I would be up higher, okay? And you'd do those over the widest part of the chest wall, okay? Widest part. Then if you have a clamp, big clamp, put that in his chest wall. Clamp down on his chest wall. Then when you raise his chest, raise up, now you're going to compress downward and up, down, up, down, up, down. By doing the up, down, you get better blood flow to his brain. Up, down, up, down, up, down, up, down. You keep on doing that until you get him to the hospital, all right? And if you are one of those guys that are in the hospital and you're not still getting anywhere, of course, that's when you have to open the chest in case. And I have had, in my 45 so years of doing this, I have had many, many patients that, in fact, have had CPR. This very hospital that I'm using now, and I want to thank Dr. Gross and everyone here at Mars Hill Animal Hospital for allowing me to use their hospital tonight because my internet is not working at home, so I had to bring all my stuff over here. And so I really thank you so much. I know we're about 15 minutes over on the time, and so I'm going to just shut it off right here and ask for questions. And I just praise you guys. Just thank you so much for being part of this this first CPR type of event, and we'll first aid. And next time we do, we'll cover more on hemorrhage, and we'll cover more on just putting a first aid kit together, and a little bit more on just how to take care of more trauma patient type things, and send in your questions, and then we'll be able to cover those a little bit too into the next session. All right. And God bless you guys now, and I'll turn it over for questions.
Okay, hi there.
Hi there.
We're calling in from Dauphin Island Sea Lab. We in Alabama. So we just had a question about how any of this might get tweaked for cats, especially because they have smaller tongues relative to dogs a lot of the time, and they're rougher too. So I don't know if there's anything that would make a difference in that.
Very good question. All right, so we'll just take the smallest kitties first. I have a little bit over here to demonstrate. I think I have one cat that I brought along. And well, if I didn't even. Let's just take just a minute. Well, I'll use this little dog. Oh, there he is. I didn't want to leave the cats out, okay? So here's my kitty. Is she cute? All right, cats. All right, the thing about cats, this really good things to understand too is, of course, it's the same. It's A, B, C. It's the same. When doing chest compressions in kitties, it's compressing both sides of that chest, both sides of that chest, and go fast. You want to try to go at 100 times a minute. And if you have a Doppler, then you put the Doppler on their eye, lube it up real good with aquasonic jelly first, and put it right on their eye and hold it on their eye. Hold it on their eye, and then do the chest compressions. And you'll listen for flow, but don't put the Doppler on so tight or pressure that you're just losing the flow. You can also put the Doppler on their inguinal, for kitties, their inguinal area. Their inguinal area works really good. Put it right there, and then you'll be able to hear for flow, or their axillary area as well on a heart. But then it's going to be moving because you're doing CPR. But it's a really good way to tell if you've got any flow at all, is to put that Doppler for a cat, right there. But maybe have to do a quick light. If it's a long-haired cat, you may have to take a little clip first with your clippers to get the hair off there, right? And then rub in the aquasonic jelly and just look. If you have ultrasound, a regular ultrasound unit, those are amazing how they can tell you how well you're doing your CPR too, because you can go through the abdomen and look at what you're doing to the heart as you're doing the chest compressions, and that will help as well. So there's a lot of things that we can do with cats. Cats, we will get into post CPR sometime about brains, but make sure that you keep these guys cold then. I would essentially make sure they're cold on the head and then the neck. If they wake up right away, that's okay. That's a big deal. But if they have a hard time, help protect that brain and that heart by especially the brain, by giving them a little bit of cold formula, if you will, right? Ice around their head and, crushed ice, and then around their head. And then if they're not ventilating, if they're not breathing right away, continue to breathe for them. That's very critical, because that brain in the little kitty is quite sensitive to the oxygenation, and you'll find that that's going to work though. We had a cardiac arrest in this hospital while I was doing surgery, and it actually arrested 4 times. But each time the Doppler told us that it was arrested while doing surgery, and we quick stop right away and do the CPR. We did closed chest, did work really well. We gave the ventilations and make sure. And that cat went on to do well. It had a knee that the cat had fallen, jumped off a refrigerator and blew out all the cruciate ligament, the collateral ligaments, and was a very unranged knee. And my granddaughter was scrubbed in with me, and I'm proud to say she's probably going to be a nurse or a doctor or a veterinarian someday, or a veterinary technician, maybe so. Okay.
We got a question from Kelly Knott. She wants to know if it's okay to have someone give the animal breast while you perform chest compressions.
Oh, yes, absolutely. I forgot to mention that. I think I said when you turn that over, of course, to a bag valve mask and you give the breast, yes, just go ahead, and both of you don't have to worry about who's doing what when. Don't stop the compressions.
And she has a
compression, just compress and then breathe. Then you can time the breath between the compression, but you will get better results if you don't stop those compressions.
Good. She also asked, which I think would happen a lot, when you're just one person, how many chest?
If you're one person, and again, this is important. If you're one person, and I'm going to go over here, if you're one person and you're doing CPR by yourself, okay, and you got no one else to help you, remember that as you compress the chest, then there is air that's going to and fro in here, as long as you got an open airway. Even if you don't have a fully open airway, you may then have the ability to get some blood flow, oxygenation through there. But then otherwise, at least do 30 of these and 2 of these, and then you should see the chest rise and fall a little bit. Then you come back and do 30 of these. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. You may then, if you have if someone else can do that, that is especially when they need to give a breath, if you have 2 people. But if you're also singly by yourself, then do 30 of them and give a couple compressions. Now that's still the little old school. No one's really ever been able to tell exactly what to do, but I think it's important to imagine that if you're doing good chest compressions, most of the time there's a to and fro of oxygen that gets through here. And that's like that man. He was an older fella, and we had no way of giving him. He had vomited. With no airway at all. And I just did chest compressions on him really well for 25 minutes, and he converted when we did the little maneuver right here. And we just pressed the right underneath his nose right there, and he converted into a pulsatile rhythm when we got to the hospital. And boy, I was tired, but and he's doing well today, and he's got his kids and all that, and so he's done really well. So there is no direct right answer, even though there's been a lot of stuff written. And I worked with the American Heart Association with Max Harry-Weil in the years back when everything was just getting started, because he's one of the founders of the American Heart, as far as I know. And we were just working on the Doppler. In fact, when I stopped being involved with as an associate professor there, it's amazing what you can do, but just thinking together. And if you have someone that can time it with you, as your compressions here, go ahead. I got to stop here. I've got to rest because I got 2 minutes and I got to stop. Well, anybody else can do these? Can do these? Yes. Train all of your people that are there to be able to do compressions. And then even anybody that's in your office, anybody, they can compress. And then you're the one that's going to be able, maybe if it's an advanced airway, you can intubate them now. And then you start to ventilate. You will ventilate during compressions. When you're doing bag valve masks, you do the same thing. And I teach a lot of people how to do that. And if the dog is awake, and he's awake and he's trying to breathe, you can put a bag valve mask on him, and then start to, of course, when he's taking a breath, it's a weak breath, but give him a breath. So you may go fairly fast because he's trying to breathe hard, and you breathe for him, and then you finally get comfortable and relax. And then, of course, on from there. Hope that was good. Hope that was a good answer.
Sounded good to me. Well, that's about wraps it up.
Okay.
But I want to remind folks that we have part 2, April 7th. We have that scheduled. So we'll send out a link and we'll follow up by sending this presentation, or you can go to the celebrationofpetsfoundation.org website. And I think we're going to end up putting this on the YouTube also. Don't know much about YouTube myself, but I hear it's a good method to communicate. And Tim, you did mention that there's a good article in DVM 360. Then we'll get a hold of that, because Tim wrote up a really comprehensive article about CPR, and we'll also send you that link to help you with your efforts with saving pets' lives.
Yeah, I've actually written over 50 articles on CPR and in the time. And when I was a little boy at 7 years old, I saw my dog get killed in front of me. And that's why I think I'm still trying to save, especially dogs, but cats too, any animal, any person that's in trouble. So I appreciate you all. Thank you so much for joining us, and we'll see you next time.
Good night. Thank you.
Good night.